Hello and welcome to Minukuu's Health Tutorials. Today's tutorial is a detailed presentation on the harmful effects of smoking and how to quit smoking. There are many smokers in developing countries than in developed countries. And globally, a lot of men smoke than women, according to the statistics of the World Health Organization in 1996. The smoke of the cigarette is composed of over 4,000 different chemicals, of which include the nitrosamine, which is an irritant and carcinogenic agent, carbon monoxide, which is responsible for hypoxia of the blood and the muscles, cadmium, which is a toxic heavy metal, benzopyrene, which is a carcinogenic tar, the nicotine, which is the addictive agent or component of the cigarette, polonium, which is a radioactive agent and can cause mutations, dioxins, which is a carcinogenic agent, and acrolein, which is an irritant. These chemicals are responsible for 23 tobacco-related diseases. For example, in the mouth and pharynx, we could have cancer occurring. In the heart, we could have coronary disease. In the esophagus and stomach, we could have cancer or peptic ulcers. In the uterus and ovary, it could cause infertility, abortion, retarded growth, early menopause, or cervical cancer. In the testicles, it could cause decreased fertility and impotence in men. In the peripheral arteries, it could cause arthritis of the lower limbs. In the brain, it could cause cerebrovascular accidents. In the larynx and trachea, it could also cause an inflammation called laryngitis or even cancer. In the lungs, it could cause cancer, that's lungs cancer, emphysema, or even chronic bronchitis. In the pancreas, it could cause cancer, pancreatic cancer. In the urinary tract, it could cause kidney cancer or even bladder cancer. In the bones, it weakens the bones and causes what we call osteoporosis. And in the skin and appendages, it could cause the development of a gray or dull complexion. As you can see, to the left are healthy lungs of a non-smoker, and to the right are cancerous lungs of a smoker already blackened by the carcinogenic tars of the cigarette, such as benzopyrene. The risk of getting lungs cancer is greatly influenced by one's style of smoking. A non-smoker has the least risk of getting lungs cancer. For a smoker who does not inhale, his risk of getting lungs cancer is multiplied by 8. For a smoker who inhales slightly, his risk of getting lungs cancer is multiplied by 9. For a smoker who inhales moderately, his risk of getting lungs cancer is multiplied by 13. For a smoker who inhales deeply, his risk of getting lungs cancer is multiplied by 17. So it's obvious that we all need to abstain from smoking in order to have the least chance of getting lungs cancer. But maybe in the case of addiction, you should try as much as possible not to inhale the smoke of the cigarette in order to minimize the risk of getting lungs cancer. But please remember, you do not have zero chance of getting lungs cancer. Even a non-smoker has 1 chance of getting lungs cancer. Then what it means is that we should just abstain from smoking. And as you can see, comparing the risk of getting lungs cancer in the case of a smoker who does not inhale and a smoker who inhales slightly, you could see that the difference is just 1. So please, let's try to abstain from smoking and even passive smoking. Tobacco also affects greatly the cardiovascular system. And as you can see, this is a blood vessel of a non-smoker. The lumen is free enough for effective and proper blood circulation. But that of a smoker is obstructed by the effect of carbon monoxide, thus making it difficult for blood passage. And this could lead to lack of oxygen and nutrients reaching certain tissues, causing what we call hypoxia. And as a result, we could have, tissue death or necrosis. And in the case where it even reaches the brain, it could cause cerebrovascular accidents. Smoking, apart from its harmful effects on the respiratory and cardiovascular systems of the body, it also affects greatly other systems of the body. For example, on the nervous system, it could cause headache, memory problems, nervousness, tremors, modification of the state of vigilance, more or less. On the reproductive system in males, it could cause decreased spermatozoa, and the spermatozoa are often abnormal and not very mobile. 80% of impotent men are usually smokers. In the case of females, it could cause cervical cancer, decreased fertility, spontaneous abortions, and even miscarriages. On the digestive system, smoking could cause cancer of the tongue, cancer of the esophagus and pancreas, or even peptic ulcers. It could also cause weight loss because smokers usually have, low appetite and they do not eat enough to gain the optimal body weight. It could also cause wrinkled skin and a very rough voice. It's also responsible for anxiety and depression. Please note that a non-smoker could also smoke indirectly, that's through passive smoking, by simply inhaling the smoke of the cigarette of somebody who is smoking. And passive smoking has effects during pregnancy, also in children, and least risk in adults. However, depending on the duration of the exposure, it could cause harmful effects even in adults. Having been able to know the harmful effects of smoking on our lives, let's try to see how we could stop smoking. Basically, there are four major ways of stopping smoking, be it pharmacologic therapies, that's by the use of drugs, or non-pharmacologic therapies, that's through patient guidance, advice, and all of that, or even combined methods of either pharmacologic and non-pharmacologic therapies. And lastly, individual psychotherapy. One thing we should know for sure is that to quit smoking, it all starts from within you. You have to have that mindset to say, okay, henceforth, I'm not going to smoke. I know it will come with challenges. It's not as easy as you may think because it's an addiction. However, you have to take the vow and say, I'm never going to smoke. And with the help of either pharmacologic or non-pharmacologic or even the combination of the two, therapies, you would succeed in quitting smoking. The pharmacological method of treating smoking addiction is based on the use of nicotine replacement therapy, where substitutes of nicotine, they could be in the form of cigarette, tablets, and many more, are administered to the patient to always restore his usual humor as if he was smoking. However, these substitutes do not cause addiction because they do not contain nicotine, which is the addictive component of the cigarette. So with time, the patient even forgets about smoking and quits permanently. However, I would never advise you to buy any of these nicotine substitutes from the market or from the drugstore simply because they, they are usually administered according to one state of addiction. So I would advise you, if you know you are addicted to cigarette, please contact a toxicologist because he's the expert and he will give you the prescription according to your state of addiction so that you wouldn't buy any nicotine substitute from the market, and at the end of the day, after taking it, it would give you maybe some side effects. So please see a toxicologist or an addictologist to help you out if you know you're addicted to smoking, cigarette for that matter. Cigarette addiction is a cycle that one must break when trying to quit smoking. And as you know, Rome was not built overnight. It's the same thing with smoke addiction or cigarette addiction. If you want to quit smoking, you have to first of all start decreasing the number of cigarettes you take per day. Otherwise, when you stop at once, there are some people who can even die out of, depression and all kind of, stress that come in. So a regular smoker is in a state of cognitive consonance where he's so cheerful and in a good sense of humor. But as soon as he thinks of quitting, he falls under a state of cognitive dissonance where he's no longer having a good sense of humor. He's so uncomfortable, he's so stressed and even nervous and all those kind of stuff. Even before having a pre-intention to quit smoking, after which he takes the decision to quit, and after which he takes an action, be it pharmacologic therapy or non-pharmacologic therapy, or even a combination of the two, or even the individual's psychotherapy as discussed earlier on. Now he starts to withdraw, and during the withdrawal, there is a very big problem that comes in, and that is what we call the withdrawal syndrome. Some of the symptoms of withdrawal syndrome include craving for nicotine, coughing, headache, sweating, nausea, and abdominal cramping. So at this point, the patient really finds it difficult. So at the end of the day, some people end up giving up to the extent that they wouldn't be able to abstain from smoking. And when this happens, at the point of abstinence, there are two things involved. It's either you break the cycle completely by stopping, or you give up. And when you give up, there will be a relapse and the cycle continues, and you wouldn't be able to desist from smoking. So at the point of withdrawal, despite the withdrawal syndrome with its symptoms, if you want to quit smoking, I would advise you to define clearly your hobbies. If you are somebody who likes, for example, playing football, as soon as you feel like smoking, get involved in playing football. If you are somebody who likes reading, as soon as you feel like smoking, start reading. In order to, because the zeal will always come to smoke. And as soon as you give up by smoking, there will be a relapse and the cycle will continue. Thank you so much for watching, and I hope this video will help you quit smoking. Please remember to subscribe and share to help a brother who is not aware of smoking and its harmful effects and who doesn't know how to quit smoking.